Can pregnant women take TB medication? When a woman is pregnant and diagnosed with tuberculosis, it's natural to have questions about treatment. The good news is that treating tuberculosis during pregnancy is both possible and important. Untreated tuberculosis can cause serious health problems for both mother and baby, including low birth weight, preterm birth, or even transmission of the bacteria to the infant. Because of these risks, healthcare providers generally recommend starting treatment promptly once tuberculosis is diagnosed. The main medications used to treat tuberculosis are called first-line drugs. These include isoniazid, rifampin, ethambutol, and pyrazinamide. Research shows that these drugs are generally safe to use during pregnancy. They do cross the placenta, but studies have not found evidence that they cause harm to the developing fetus. In fact, the benefits of treating active tuberculosis outweigh the potential risks of medication exposure in utero. It's common for doctors to prescribe isoniazid and rifampin during pregnancy, sometimes with vitamin B6 to help prevent nerve side effects. Although drug levels may be slightly lower during pregnancy, the doses are adjusted to ensure the medication remains effective. Monitoring is important to make sure both mother and baby stay healthy throughout treatment. When it comes to latent tuberculosis infection, which means the bacteria are present but not causing illness, treatment during pregnancy is more carefully considered. If the woman has no other risk factors, doctors might delay treatment until after delivery. But if she has a high risk of developing active tuberculosis, such as with HIV infection, treatment during pregnancy might be recommended to prevent future health issues. Treating multidrug-resistant tuberculosis is more complex. Because fewer drugs are effective and safety data are limited, managing MDR tuberculosis in pregnancy requires specialized care. The risks are higher, so treatment decisions are made very carefully, balancing potential benefits and harms. Testing for tuberculosis in pregnant women involves safe methods like skin tests or blood tests. If active disease is found, chest X-rays can be done with precautions to protect the fetus, such as shielding the abdomen. The goal is to diagnose and treat as early as possible to prevent complications. Breastfeeding is generally safe for mothers on first-line tuberculosis medications. The levels of these drugs in breast milk are low and not harmful to the infant. Mothers are usually advised to continue vitamin B6 if they are taking isoniazid to help prevent nerve issues. In summary, treating tuberculosis during pregnancy is essential and can be done safely with proper medical supervision. The medications used are supported by scientific research and health authorities worldwide. Pregnant women with tuberculosis should work closely with healthcare professionals experienced in managing TB to ensure the best outcomes for both mother and baby. Always consult your doctor for personalized advice tailored to your specific health situation.